Dear clients, this is Wilfred Ling. Welcome back to my channel. In this video, I'm going to analyze Novo Nordisk and explain why I think the company is a great company. I'll be explaining A. The business overview of the company, B. What are its competitive advantages or known as moats, if any, C. What are the long-term growth of the company, D. What are the risks in investing in the stock, E. An examination of the fundamentals of the company. The business overview of the company. The company is a pharmaceutical company that researches and manufactures drugs related to diabetes, obesity, and other rare diseases. It is the largest diabetes medication manufacturer in the world with more than 30% market share. According to the company's financial 2022 revenue contribution report shown in Table 1, the company's revenue is primarily generated from three broad chronic categories, including diabetes care, which is 79%, obesity care, 9%, and rare disease, 12%. As a chronic disease drug manufacturer, most of its revenues are recurring in nature. In the area where the company operates in, pharmaceutical drugs are typically protected by patents, which have expiry dates. These patents are designed to encourage pharmaceutical companies to invest in further research. While these patents are in effect, the companies holding them have exclusive rights to the patented drugs, allowing them to recover from their investments. Once patents expire, competitors gain the ability to produce drugs with the same compounds, ultimately reducing the long-term social cost of these medications. Since diabetes medication take up 79% of the revenue, let's focus in this area of business first. Despite medical advancements, there is still no cure for diabetes. However, diabetes can be managed through diet and medication. In 2022, diabetes medication in total industry revenue amounted to about $65 billion as shown in Table 2. The top 6 diabetes medication manufacturers have been dominating 90% of the global market share, as shown in Figure 1. The company alone accounted for 32% in 2022, a 2% increase from the previous year. What are its competitive advantages? Diabetes is a non-curable chronic disease. Its revenue stream for diabetes drugs is sticky by nature. Patients once diagnosed with diabetes would need to be on medication for life. Overall, I think this sub-segment naturally favors the incumbents with strong research track records and continuous research efforts for the following reasons. First, the company's competitive advantage is experience, knowledge, and intellectual property. Cure for diabetes remains elusive today. It is likely that research will persist until a cure is found. Nevertheless, each new development and invention that a company develops contributes to a deeper understanding of the disease through collective experience and clinical trials. These include those that may not have succeeded. These valuable know-how, experience, and expertise provide them a strong competitive advantage over its peers who lack access to such data. This advantage is likely to result in development of higher quality and more effective medications. Second, brand equity is a competitive advantage. Even as patents expire, brand owners who continue to invest in new products can leverage from their brand reputation. Take for instance, the prescription of insulins, which are typically done by qualified physicians or doctors. In this context, doctors and medical professions act more like customers. To minimize risk, doctors tend to favor well-known brands over prescribing newer brands unless the presence of a significant medical breakthrough. This implies that pharma companies with strong track records within the medical community will be considered the preferred choice. Third, sales and distribution channel. As brand reputations grow, it becomes easier for this brand to use their adoption rates and establish track records to enter new institutions, hospitals, pharmacies. The availability of their products in pharmacies where they are accessible to consumers naturally exposes these brands and enhances their perceived value among patients. What are the long-term growth of the company in the area of diabetes? The prevalence of diabetes is expected to increase significantly due to various factors such as urbanization, aging population, reduced physical activity, and rising obesity rates. According to Table 3, the International Diabetes Federation predicts diabetes will become more widespread at a growth rate of 8 to 10% per annum. Personally, I find these projections to be both reasonable and conservative. I believe the numbers could be higher potentially, especially as improved healthcare accessibility may lead to a higher rates of detection. Profit margins appear to be heading in a positive direction. Diabetic drugs have patents that eventually expire. However, the company serves as a strong example supporting the brand equity discussion mentioned earlier. Despite the gradual expiration of diabetes medication patents, the company has consistently managed to increase both revenue and margins within the diabetes care portfolio. As shown in Figure 2, the operating margin within the diabetes segment is consistently on average 40%. This suggests that the company possesses high-quality products trusted by healthcare providers and is a reputable brand that continues to command better margins while gaining market share from competitors. In terms of shareholdings, the company operates under an enterprise foundation driven by non-profit causes prioritizing medical research for the betterment of society. With 77% of the company votes controlled by the foundation, it is evident that research and development ranks among the company's highest priorities. The foundation is led by a scientist by vocation. Prior to this, he served as a chief scientific officer at the company. Moreover, the current chairman of the foundation was the previous CEO of the company too. In my view, this leadership structure is ideal for promoting scientific research while maintaining business-oriented goals. According to Table 4, its R&D expense has been rising consistently in absolute terms over time. When viewed from R&D versus sales perspective, R&D expenses appear relatively stable. Nevertheless, the company appears to be investing less in R&D when viewed alongside with its peers. Let us now look into the obesity segment, which contributes 12% of its revenue. The obesity segment represents a relatively new and adjacent market for the company. While it contributed 12% to financial year 2022, it now accounts for 18% of the first half of 2023 revenue. This is expected to increase significantly going forward. Started with Ozempic, the key ingredients was originally developed for type 2 diabetes. Clinical trials revealed that a statistically significant portion of its users experienced weight loss. Consequently, some doctors began prescribing Ozempic to patients for the purpose of weight management. Recognizing the weight loss effect, the company doubled down its effort into obesity research and subsequently launched Sazada in 2015. The company's foray into obesity segment didn't gather substantial attention until the release of Wegovy, a significantly more effective weight loss medication compared to its predecessor. Wegovy gained widespread attention, and its popularity surged after Elon Musk tweeted his use of the medication. Following Elon Musk's tweet, there was a huge surge in demand for Wegovy and Ozempic, leading to supply shortages. Patients on Ozempic for diabetes were forced to ration their dosage. As a result, the company became a frequent topic in global news. As a leader in this landscape, the company initiated efforts to redefine obesity as early as 2013. This initiative has profoundly reshaped how the world perceives obesity, leading to formal classification designating obesity a chronic disease by the American Medical Association and European Commission in 2015 and 2021 respectively. Obesity is frequently regarded as the underlying factor contributing to major chronic illnesses including cardiovascular diseases and diabetes. Many prescribed obesity medications are intended for long-term weekly consumption, spanning several years. With the recurring revenue streams, patient protection and prescription-based distribution, I see similarities in the economies with diabetes segment. Let's now look at market share split and notable players in the obesity space. As of April 2023, there are 7 FDA-approved obesity drugs. Nevertheless, the obesity segment is currently dominated by duopoly, with the company's Wegovy as one of those. As shown in Table 8, Morgan Stanley estimated that the market size could reach $50 billion global revenue by 2030, even surpassing $100 billion in the longer run. The question is, what is the market size for obesity? According to WHO, there were more than 1.9 billion adults who were overweight in 2016. Among these, 650 million were obese, defined as BMI above 30. The obesity prevalence is expected to cross 1 billion population by 2030. What are the risks investing in the stock? First, pricing regulation. The surge in insulin costs have prompted US government to intervene with pricing regulation. 2. Litigation with US government regarding the 340B program mandates drug manufacturers to offer discount on outpatient drugs for providers serving low-income communities. Third, market exclusivity was proposed to be reduced from 8 to 6 years in EU. This change, if successful, would fundamentally impact the market attractiveness, thus innovation pace of the entire industry. In summary, the company has a proven track record in diabetes obesity sector. Because it is majority owned by a foundation, the management team can focus on long-term. The company is an industry leader in niche segment, a moat in knowledge work industry, and it now has a new and huge adjacent markets, namely the obesity market. The risks are ongoing litigation that could materially impact balance sheet and sensitive to regulatory changes. One thing to note that while I feel that this is a wonderful company, as your financial advisor, I must caution you that you need to get 3 things right to be successful. You need to buy the right company, buy at the right time, and sell at the right time. If you get one of these wrong, you are almost certain to lose money. That's why never act on your own without consulting me. Do ensure you attend my live client exclusive webinar, which I will perform an analysis of the company's financial statements, as well as my opinion on when is the possible right time to buy this stock. When in doubt, feel free to contact me.